All right, welcome to another episode of the Meat Mafia podcast. We are rolling here with Dr. Kevin Stock, who is a dentist and a carnivore or animal-based. I'm not sure how you want to identify yourself, Dr. Kevin, but we're really excited to have you on and excited to dig in here.
Yeah, thanks for having me. And right now the diet's pretty simple. It is, for the last several weeks at least, I've only eaten ground beef and raw milk.
Wow.
This little experiment I got going on, a little raw milk experiment going on. We can talk about later if you're interested. But yeah, it's been pretty simple. Two foods. I buy sides of cows. I literally just picked one up before this podcast this afternoon. And when you get to when you buy a cow, like a side of beef, half of it's ground beef. So I got to the end of it and it's all ground beef left. So I've just been eating ground beef and I've been doing raw milk the last several weeks.
I've got to ask, how'd you get inspired to do the raw milk and ground beef? Was this something you read, or were you just kind of like curious about kind of the combination of the two?
I just ate my favorite cuts of the steak first. So I had only ground beef left of the cow remaining. So that's how that happened. The raw milk experiment came out of, I've done a history of, I guess, decades now of diet experiments. And in the last 6 years or so, diet experiments really within carnivore, but I had never tested in milk. And so I wanted to do, is this one of those things I was like, all right, time to test milk. I've been asked enough about it. And I like to be able to talk from my personal experience as much if I can.
Right.
And so I'll tell people, like, I've written about dairy and I'll point them to my blog, but I haven't been able to like talk from personal experience. Yeah. So that's why I'm doing this current experiment right now.
Very cool.
Nice. Yeah, you and Clemenza pretty much have an identical diet right now, by the way, because Clemenza drinks a ton of raw dairy. And Harry, didn't you just do a week long, pretty much all raw dairy fast?
Yeah, I did 4 days of just consuming raw dairy, raw milk. Same kind of story, just curious. I like experimenting too. And I had done enough reading where I was comfortable. I was like, this isn't just some crazy diet. I actually have been reading this book called The Untold Story of Milk, which is like, talks about the pasteurization process and how it all came to be. And are you familiar with it?
I don't know that book, but I am familiar with the history of pasteurization.
Okay. You should definitely read this book. It's really good, really well done. And anyways, he cites a lot of studies from doctors back then using raw milk as a cure for a lot of these chronic diseases. And I was just like, I mean, I don't have any chronic diseases, but let me see how I feel just drinking raw milk for a few days. And I kept the same activity level. I'm an active guy, go work out and run and do all these things, and felt amazing. So that gave me, I'm like now more interested in testing it out as something like a little bit longer, just to see what else is there. But yeah, I think it's a cool experiment and it's forgotten science, I think.
Yeah. Are you guys familiar with Dr. Weston A. Price?
Yeah.
So he's a dentist.
Yeah.
And the book is fascinating. I'm actually rereading it. It's behind me right there. Because I'm rereading it for various reasons. But in that book, like when he, travels around the world studying indigenous tribes to people that have modern food has entered into the diet, a lot of these tribes, maybe not a lot, but a good amount were very much subsisted on like dairy. And then even if they may have had some like grains in the diet, but it's like the dairy that separated the healthy people from like just complete degenerative diseases, both of like the oral cavity as well as like the body in general. So it's like dairy does have, like, I'll call it some superpowers, but really I think a lot of it has to do with like fat soluble vitamins, where people are probably inadequately not getting enough D, K2, A.
Definitely. And speaking of Weston A. Price, so you're the first, we were saying this before he hit record, you're the first dentist that we've actually had on the show, which we're really excited about, because we've talked in previous episodes, just like the overabundance of soft food in the traditional Western diet, and, the way that affects your teeth, your jaw health, et cetera. And you mentioned that you've done a ton of self-experimentation with different types of diets. It sounds like a meat-based diet has worked really well for you. And you're absolutely thriving. So I think we'd love to just learn a little bit more about, your background and your experimentation, and kind of how and why the meat-based has worked the best for you out of everything you've done in the past.
Yeah. So I'll make it as brief as possible, because really it is over 20 years of like experimentation of diets. It's been like the one consistent, probably passion in my life that has persisted. But I struggled as an overweight kid. And I remember it was junior high, 7th grade, where it was like I finally had enough, I don't know, consciousness or agency to be like, all right, I'm going to do something about this. I also had I have a brother who's a year older than me. I also have 2 younger brothers, but the one a year older than me also struggled with his weight. So we were both in junior high, same junior high. And it was about the same time we started both be like, all right, we're going to handle this. We took different paths. But that was that was when the diet experiment started, and they started off really badly, like horribly, doing things I would never recommend anyone do. But I've tested out all the macronutrient combinations that you could do, like including like solo fat, solo carb, solo protein. And I'll say probably by the end of high school, like I felt like I starting to get a decent body composition. Then in college, I went into the sciences mostly because I was only interested in health and fitness. And I was like, I don't really know what I can do. So I got a degree in chemistry and minor in biology. But I really funneled the sciences through like how to build muscle, lose fat. And I started to get like my body composition got better and better and better as I, kind of learned more and applied what I've learned through physiology and just, reading random stuff as well. I went to dental school. Long story why I chose that over med school, but we can dive into that later if interested. But I went into dental school. And I realized like my first year in dental school, I was like, I don't think I want to drill cavities for, 40 hours a week for the next 40 years. And my real passion is in health and fitness. So I started just kind of like, I guess you call it blogging about my fitness ideas. I created a couple like fitness programs, and I'm kind of person that like wants to practice what they preach, I guess. So I was never really interested in physique competitions, but I thought it was a good way to kind of, here, I created this program, I'm going to do it, then I'll do a physique competition. So I've done a few physique competitions. But so I did that in dental school. When I graduated dental school, I started to practice in a unique area of dentistry called dental sleep medicine. So it's basically treating sleep disordered breathing. Happy to go down that rabbit hole if you guys are interested. But so I took a big interest in that because I think sleep disordered breathing is perhaps the most underdiagnosed, serious, prevalent medical conditions of our time. And so I saw like an area that maybe I can add some value into this world in that. So that's what brought me into dental sleep medicine. And I ended up creating a device called the NED device, which helps treat sleep disordered breathing. I made that for my patients originally, and now it's a anti-snore device. We're still working on getting it FDA approved for apnea, but that's another project I have going on. But how does this lead into meat-based? So I was able to get the body I wanted, and I had falsely, naively, maybe arrogantly assumed I knew what it took to get healthy, right? But really, I knew what it took to get fit, and I didn't realize health was another side of the equation. And because I personally wasn't feeling good, is a host of symptoms where I'm like, I'm 30 years old, and like, why am I like, I'm living with like coffee next to me to try and like perform. And there's a myriad of other things, but mostly I was lacking the mental performance that I wanted to get the work done that I wanted to do. So I'd done ketogenic diets in the past. I went back, did a ketogenic diet again. But this time I said I wasn't going to cheat on the ketogenic diet, because in the previous ketogenic diets, I always cheated with protein, keeping it higher than typical keto diets would recommend for body composition reasons. But this time I was like, I'm going to, limit the protein, and I proceeded to lose a ton of muscle mass. And this led me to being like, okay, that I was willing to sacrifice a little bit of body composition for like the health, but not that much. And I was also like, if I'm losing that much muscle mass, this is probably not the best diet for me, at least. And so I had done lots of research, nutritional research. And for the first time, I actually kind of like took the research around Dr. Bruce Ames, who talks about these plant toxins and such. And I was like, you know what, I'm going to remove lectins and oxalates from my diet. And I known enough at that time where I started removing them. I'm eating mostly meat, but I could not just subsist on chicken breast like I'd previously done. So for the first time, I started eating red meat in any real quantity. And so I basically pulled these two levers, which seemed like small things, but my diet was 100% different. So it was like all red meat, no plants. And I felt like better than I'd ever felt. Mentally, physically, I started putting the muscle back on, and I was like, man, there's something here. And so like I was talking about, I'd started a blog in dental school, talking about fitness. Basically, I shouldn't say health and fitness. I should just say fitness. So I started, I had this newsletter where I was just mailing out like to people like, hey, here's a 30-day guide to this all meat diet that I'm working on, and this is why I'm doing it, which turned into be the ebook where I have on the website, like Health Dangers of a Plant-Based Diet, which are some of the reasons why I remove plants. Then the 30-day guide is like, this is how I recommend transitioning into it. And those went very popular. And I guess this kind of brings things like 360 degrees. Like I had my email in the guides. And so I got tons of emails from people, and that really kind of spurred my interest to help these people. I started meat.health, which is kind of the site I run right now around meat-based diets. I personally have found I do best with like meat only. I've experimented with like adding in some plant-based foods here and there. And I think there's time and place for people to do that. But yeah, that's kind of the history, as brief as I could kind of wrap that all up.
When you're on this meat-based diet, are you still getting into ketosis at any point, or because you obviously know what that feeling feels like? I feel like it's a little bit more cerebral. Whereas like when I feel like personally, when I'm eating meat-based, I don't get as deep into it, but I probably do at some points.
You know what's interesting? So over the last 6 years, since I've like really started eating only meat and then doing various experiments, the last, I would say, couple of years, that I was only like strict meat only for over 2 straight years, not one plant. But when I tested in plant-based foods, interesting experiments where it's like, okay, I had brought plant-based foods. Like I found out I did okay with potatoes. That's like my one food, plant-based food, I seem to be able to consistently do well with if I peel it, cook it. So I had potatoes for several weeks in a row. And then I took them out and just went straight back to only meat. And 100% I'm in ketosis right now because I'm only eating meat and raw milk. But the transition into ketosis, usually you go through like keto flu. I had no transition at all. And so first of all, it's worth mentioning when I do the potato experiments, it's not like I'm eating tons of potatoes a day, like one a day. So even then I was probably in ketosis most of the day. Maybe it knocks me out of nutritional ketosis for an hour or two before I'm back in it. But I think it is interesting, the metabolic flexibility that's like, I felt no transition at all, really. And like, I know you said, I personally am not, I don't notice it that much when I'm in deep ketosis versus not deep ketosis, personally. So like right now, I'm sure I'm in fairly deep ketosis because I've only eaten like fatty meat and milk for numerous weeks. But I think if I went and like ate some potatoes right now, I don't know if I'd feel worse. Probably not, from the experiments I've done.
Dr. Kevin, what do you think it was in particular about red meat that made your body respond so well to it compared to some of the other diets or meats that you had been incorporating in the past during your like the physique days that you were talking about, where it's like all dried chicken breast and rice and broccoli and things like that?
Yeah, that's basically, so the bodybuilding diet was very much heavy, lean chicken breast. And then I would call it filler vegetables. Like I would eat tons of broccoli because fill my stomach up, not a lot of calories. I had other tools in the tool belt, like pickles, embarrassing amount of pickles I would eat and things like that. The things that don't have a lot of calories, I could fill my stomach up, eat a lot of chicken breast. And I would do some other strategies. Like I would rotate in what I would consider, quote unquote, at the time, healthy fats. Like I'd eat eggs because I knew I needed fat in the diet, but I just thought I kept it real low. And I would also sometimes rotate in carbs, keep muscle glycogen full. So I would do sweet potatoes back then. But I think to answer the question, like with the red meat, I think the big thing is the fat. Like first of all, getting like high quality, sufficient amounts of fat. I think that probably made the number one difference. But also, like if you compare the micronutrients even of beef versus a plain old chicken breast, like they're hardly even comparable. So I do think there's a lot of like a ton of more nutrition I'm getting from the beef. And I also think decreasing the massive amount of plant foods that were giving me digestive issues also had an impact. So it was kind of like two things at once, kind of pushing me in that direction.
What's interesting to that point too, is that a lot of these golden era bodybuilders that are regarded as having the best physiques of all time, whether it's like Arnold, Tom Platz, Frank Zane, they love fat. They were eating a ton of steaks, cottage cheeses, egg yolks, etc. It's only like the last 15 or 20 years or so that we've like run away from fat. Whereas like in the 70s, those guys were hammering saturated fat and they looked so aesthetic. Like I think Vince Girondo would eat like 30 eggs a day or something like that. So it's pretty interesting.
It is interesting. It is. And I do think like you can get super lean on very low fat. However, it is very I don't want to say unsustainable, because there are cultures that sustain low fat diets, high carb diets, and stay lean, like Chinese rice farmers, various kind of potato farmers. But I think if you're really trying to optimize performance, especially like hormonal stuff, like having a decent amount of saturated fat from animals is a key component to that.
Mm-hmm.
Dr. Kevin, what sort of other health things did you notice changing when you started getting on a higher fat diet? Was there any like skin clearing up or mental awareness, or mental sharpness, things like that?
So the mental sharpness was the reason I started, and that was the biggest thing I noticed, where I have this personality where I need to be going all the time, or I have a list that requires me to be going all the time. And so that was the number one thing I noticed. Like, it was out of the gate, I was like, my brain was turned on. I was going, the brain fog, the tiredness, that went away. Improved sleep for sure. And which is surprising to some people, because that was actually two things to that. One was sleep actually took a little bit of a downfall, I would say, for a short period of time, but it didn't impact my energy during the day. But then the sleep kind of got regulated. So I have hypotheses of probably why that happened, getting into ketosis and perhaps some elevated cortisol short term. But sleep got better. My performance in the gym prior, when I was doing like the protein restricted keto, it went way back up. So comparatively to where it was, probably better than it was. Like right now, I remember in my late 20s, I was starting to get like joint pain, being in the gym for, at that time, probably 2 decades every day, multiple, like 2 days were pretty common. I was getting joint pains. And right now my joints have not felt like as good as they do right now in a long time. I do need to give some credit to that too. For the first time ever in 2020, I started doing resistance band training because my gym here closed down. And I do think the resistance band training I've been doing has really helped my joints out. So combination of that and the diet, I've seen noticeable improvements in joint health, things like libido, energy, basically, yeah. Energy is the biggest one, specifically brain function energy, but also, getting the body composition back. And to me, it's real. For the first time, like in 2017, I felt like I could, quote unquote, have my steak and eat it too. Meaning like I could have the body I want, the fitness, and, feel good at the same time. And, I'd be hard pressed to try and like find another diet besides like an animal-based one that's going to deliver on both of those aspects.
Yeah, no, that's an amazing story. And one of the things we wanted to ask you too, I know you touched on the sleep disordered breathing, the sleep apnea. How closely interwoven are those things with nutrition and diet? Do those affect each other at all?
I think they're crucially, well, so there's two things. There's crucially important. One is during development. Okay. So we talk about that. And the second one, it has to do with obesity. So if obese people, they store fat in the tongue. I get fatty tongue is what I call it. And our mouths tend to already be smaller than they should be. And that's due to the developmental issues. So now you have this big fat tongue and a small mouth, and there's only so much room. So it started impeding on the airway, and that leads to obstructive breathing. So that's the one. The developmental ones, I hate telling this, like looking at like in the picture, but my face is a perfect example of like developmental like problems when you have inadequate nutrition. Some of it may be epigenetic, so I'm just going to blame my parents, but I don't think I had great nutrition as a kid. And so a thing that we'll see, like Dr. Weston A. Price, like was kind of like the pioneer of this, where he saw this so clearly when he compared indigenous people eating basically animal-based diets. There were various kinds of animal-based diets, but when they transitioned to eating modern diets, what he saw is the maxilla, which is the top jaw, started to be underdeveloped, and the mandible, the bottom jaw, would also be underdeveloped, probably for two reasons. One, because the maxilla is underdeveloped and the teeth want to occlude properly, but also, as you guys talked about earlier, like the soft food diets, and the jaw needs the stimulation, kind of like a muscle, to adequately grow. And so the jaws are inadequately growing. And then we have the dental arch, which holds the teeth. Those are too small. Teeth start coming in all in weird directions. So we need orthodontics, we need wisdom teeth plucked out. But all this to say is, like, when the facial structures are underdeveloped, you tend to see like a long, skinny face, like I have, unfortunately. We should have like high cheekbones, broad jaws. Like that's the kind of face, like a well-developed face. But the kind of face like I have, and a lot of people that had poor developmental nutrition, you won't get a fully maxilla, and therefore you won't have fully formed sinuses. The nose tends to pinch in, and it leads to mouth breathing, which also exacerbates the sleep disordered breathing. So yeah, it's kind of those both developmental and with the obesity epidemic, both of those are playing into what I would consider the sleep disordered breathing epidemic.
So there's a lot of really, I would say, like semi-alarming sleep data out there where, like, over the past century, we've lost almost an hour off of our sleep on average. That's probably due to a number of different things, but diet, you could probably lump diet in there for sure. And like the causal or like the effects of that are so widespread in terms of like your overall health is going to take a massive steep decline if you're not getting enough sleep. How do you think about those topics, and like what are we dealing with here with like sleep deprivation and things like that?
I think there's a lot of things here. One is kind of a story. When I started my sleep disorder breathing practice, you take a health history of all your patients. And, I'm just a naive, kind of fresh out of dental school, 26-year-old kid. I've done some advanced training in the sleep disorder breathing arena, but I'm taking these health histories and everyone is on antidepressants, like everyone. And I'm like, and it's not that necessarily that sleep is causing people to be depressed. But there's like this huge, like massive correlation. And then if you start looking in the research and you start correlating, sleep apnea basically correlates with almost every kind of chronic disease you have. And so it goes back to kind of what we were talking about earlier, is obesity tends to be a causal of sleep apnea because of fatty tongue and restricted airway, which tends to have all these other downstream effects. So that's one part of it. And I had another part, which, I'm going to make sure I fully answer your question. It was, I'm trying to think, what was the question? I get on these two tangents.
Come back to it. One of the things I was talking about, like the loss of, or like average sleep.
Oh, thank you. Yeah. I forgot the question. So there's this idea of like sleep time, right, in bed versus sleep quality. And I would actually be more concerned about the loss of sleep quality than sleep time. So I probably sleep 7 to 8 hours a night. But when I sleep, like I am getting high quality sleep. I'm getting, the deep delta sleep. I'm also getting the adequate REM sleep, where I think people, especially with sleep disordered breathing, is those two states of sleep, they will not get in, because both deep sleep, you'll lose muscle tone, and REM sleep, you lose muscle tone besides your eyes and your diaphragm, basically. So you're basically paralyzed during REM sleep. And so the muscle tone that is used to keep your like tongue up and the airway open, you start to lose that muscle tone when you fall into those deeper levels of sleep. And so sleep apnea gets really bad. The obstruction on the airway gets worse. And so the body will wake itself up, often subconsciously. So the body's constantly waking itself up all night long. And so they never drop into these deep levels of sleep. So I would see a patient, and patients go 5 to 10 years of suffering from sleep apnea before getting a diagnosis on average. So it's been years, if not decades, of them not ever getting into this deep level of sleep. You treat them for the first time, it is literally like they're a new person, because they get a deep level of sleep for the first time in potentially like a decade or more. And so that's super important. If you were literally sleep deprived every single night, it's hard to imagine not having high blood pressure, not being on antidepressants, not having like basically all the chronic diseases that are associated with like elevated cortisol. You're more prone to obesity. You don't have any energy during the day. So you're craving, sugar and fat, junk food. You don't have any energy to go to the gym. It's a pretty vicious spiral. And so sleep may not directly cause these things, but it indirectly, at least, very much exacerbates pretty much all the chronic diseases.
Dr. Kevin, do you have any recommendations on how to just improve overall sleep quality and sleep hygiene?
I think there's a few things. One is, I think when people get their diet right, that goes a long way. Because then you have the energy to exercise and move around, which is good, which in itself is going to improve your sleep. So the lifestyle things like diet and working out, I think, go a long way. And then there's the classic kind of like sleep hygiene things, which I do think are important. Like I go to bed every night roughly within the same hour, and I wake up at literally the exact same time without an alarm clock. And so that's one of the biggest things when it comes to sleep is the schedule called sleep hygiene. Going to bed at the same time, waking up at the same time goes a long way to creating this habituation. There's also a lot of other things like not eating 3 to 4 hours before bed. That tends to help a lot of people with their sleep. You don't want to be digesting when you're going to sleep. You want to be going into sleep. Other things, screens, blue light. It's best to like start turning those things down. What I'll do is like, if you have like a yellow lamp, that's better than like an overhead light, because overhead lights kind of signals to the brain it's noon, like not ready to go to sleep. So you turn those off and turn on like dimmer lamps, like in the evening. I think that helps. Getting sun in your eyes when it's rising in the morning, it helps set circadian rhythms. So these are some things. Cold bedroom for me is crucial. I think a lot of people benefit when they actually take showers at night before they go to bed. A warm shower at night tends to help people. Body temperature needs to drop before you fall asleep. So some of these things can help. So there's a lot of different like little things you can do that here and there to improve things. But I think the major things, you got the diet right, if you're moving during the day, some of the sleep hygiene stuff, that goes a long way. And that goes, I guess it goes without saying, is like someone that has sleep disorder breathing, airway collapsing, getting that treated goes a long way to improving your sleep. That's actually the biggest thing you could do if someone is suffering in that way.
Yeah. It's amazing how upstream sleep is, but then you even say like people, if you want to fix your sleep, like start to fix your diet. So even diet is even potentially more upstream than that. One of the things I was curious, you talked about childhood nutrition when it comes to, all the work that you're doing when it comes to facial structure, development. What sort of things would you recommend to yourself back when you were in middle school, making all those dietary changes? Or better yet, what would you recommend to the parents for them to actually make those proper nutritional choices?
Yeah, I would have started the raw milk experiment back then.
Yeah.
Not now, not 35 years later. That's what I've done first. So the two areas of dentistry I work in is, one is I do pediatric dentistry. The other one I do dental sleep medicine. So I see kids and I see the state of their oral health and their dentition, and it is tragic. And so an interesting paper came out earlier this year where they reassessed like what's the ideal, early nutrition, and kids can't eat a lot. So when they do eat, it needs to be as nutrient dense and as bioavailable as possible. So no wonder they recommend red meat as an ideal first food for children. I agree. I think breastfeeding, for a good period of time is super important to proper growth, but it also is important for, the mother to have adequate nutrition to pass that nutrition on to the child. So there's prenatal nutrition, which I think is important in development. But once like childhood, roughly right now, kids' diet is about 70% ultra processed food. So it is tragically horrible currently. So what I tend to like try and pass along to kids is like, let's increase the meat intake, the red meat intake, and just start decreasing some of the 70%. But if it was me doing it all over, like red meat was not really eaten in my family very much. And that's probably why it's one of the most interesting things. Like I was someone that was so like kind of tuned into reading about research and health and fitness for all that time. And I still never ate red meat during that time, because there was like this unconscious thing that like red meat's bad, saturated fat's bad for you. And even though I had no evidence to back that up, just because I was brought up with that and it's like culturally accepted. So if I was a child again, I would eat just red meat, raw milk. If I do fine with raw milk, European ancestry probably. So I have this lactase persistence where, like right now, the raw milk experiment is going just great. I have no GI discomfort. I feel great. No adverse effects. There are some people that is not true for. But yeah, if I was a kid again, that's what I would be eating. I would be eating red meat and, dairy, full fat dairy, raw preferably. Yeah.
Yeah. And you're talking about how important it is to incorporate saturated fat, particularly amongst kids when they're in that growing stage. How concerning is it for you to see these cities like New York City adopting meatless Mondays and vegan Fridays and kind of pushing these dietary restrictions on kids?
So one of the reasons I do the pediatric dentistry is like, I do have like a soft spot for children. Like they can't make the decisions themselves, right? They're not educated enough. I was in that position myself where it's like my parents were doing the best they could. I'm sure maybe these New York schools, I think it's the right thing to do. But I do think it's just absolutely tragedy. I think half of preschool children in the US are deficient in iron,
Mm.
B12 deficiency. Kids that are like, I think there is 500,000 people, children under the age of 5 in the United States on vegan diets, not by choice. And to me, that is just unacceptable. Like B12 deficiencies, neurological disorders, you put this kid at risk for life. Not only just the developmental things where you have a long, skinny face like me, there's some inconveniences, you can't breathe as well, like severe consequences. So yeah, to me, it's quite tragic. And I think the requirement should be the exact opposite. Like we need to have a minimum amount of this amount of meat for each child. That's how I feel about it.
What's the average? Is like 2 ounces of meat consumption?
Red meat consumption per day in the
Yeah.
United States on average. I think it's less than 2 ounces of red meat
1.8.
Yeah, 1.8. It's ridiculously low.
Abysmal.
And what fascinates me is like this number is so low, and then for some reason there's like the strongest propaganda against this 1.8 ounces of red meat. I'm like, look, this is not causing obesity. This 1.8 ounces of red meat is not the rise of all these chronic diseases. It's not because we're eating 1.8 ounces of beef a day. Like that's not it. You need to focus your attention on where the real problem is.
Yeah. One of this is going to be a little bit off topic, but one of the videos that I saw you make was around wisdom teeth. And I'm really curious to get your take on this one, because I've honestly never heard anyone say that like getting your wisdom teeth out is the thing that like shouldn't necessarily happen naturally, but intuitively it makes sense.
It's pretty controversial. And one of the things like I try and do on social media, which is sometimes hard because it loses a lot of context, but especially like in dentistry, we've normalized pathology to the point where it's like, hey, it's normal that you have 20 cavities in your teeth. It's normal to have teeth pulled out. It's normal for all these kids to have asthma and be on, Ritalin for these are not normal, but we normalize these things. And wisdom teeth is one of those things where the evidence, if we look at like the archaeological record of skulls, they have their wisdom teeth. And that was at a time when our jaws were already smaller. We had the big brain. So it's not like anything like that. Like we should have room for our wisdom teeth. And like we talked about earlier, it's the inadequate development of the maxillum and mandible from both inadequate nutrition, inadequate stimulation of the jaw, that there's no longer room for the wisdom teeth. So myself, I had mine taken out when I was like 12 or 13 years old. And yeah, we shouldn't necessarily be having to get everyone go to the oral surgeon to get these teeth, chucked out.
Are there any other just standard like dental practices, whether it's like fluoride or things like that, that are widely accepted that you just personally disagree with?
Isn't that crazy? So fluoride is a perfect example. We started using fluoride, I think it was in the 1940s in Michigan. And we go back before that and we look at like Dr. Weston Price. I'll just refer to his work because I think it's some of the most important like epidemiological evidence that we have, directly comparing with the naked eye. This is like the advent of the camera too, so we could see native indigenous tribes and the modern diet. They did not, like, they're eating their native diet. The rates of decay were so small, like 1% of people, and there's various diets where they would have a little bit more than others, like certain people that included more agriculture tended to have more decay in their teeth. But yeah, we didn't have decay prior to fluoridating the water when we had an appropriate diet. But because I feel like fluoride is like the classic Band-Aid solution, it's like, all right, let's not try and fix the diet. Let's turn a blind eye to that. Let's add something to try and put a Band-Aid on decay. And, fluoridating the water to me is so dumb, for lack of a better word. Like, we're taking this fluoride and we're taking it systemically when all we want is a little bit in our teeth to make them a little bit harder, which shows minor amounts of improvements. It does tend to show a little bit of improvement in resistance to decay, probably because the teeth were not formed as well as they should have been because of inadequate nutrition. But long story short is, yeah, like I'm totally against fluoridating the water. Even though it does seem to have a small benefit when you do fluoridate the water, I don't think it outweighs we don't even fully understand the consequences of drinking fluoridated water. So that's definitely implicated in different neurological disorders and things like that. And like here, like the water's fluoridated. I don't have a say. Like I live here, so my water's fluoridated. I would prefer to have a say, like if I wanted to fluoridate my water, but it's just one of those, public health initiatives that, it's still prevalent here in the United States, but the rest of the world has basically gotten rid of it, which is interesting.
Yeah. Do we know like some of the, because you read stuff online and there is some side effects of fluoride consumption with like cognitive impairment and things like that. Is that the main one that you would think of?
Yeah. I mean, the studies in kids, and they show like statistically significant drop in IQ. So to me, that alone is like, look, if you're going to eat a terrible diet and you're going to have cavities, we'll take care of those, but that's not worth the IQ, in my opinion. We'll never be able to solve these problems in the future if everyone's IQ is dropping.
Right.
Yeah. Yeah. Dr. Kevin, going back to just like nutrition and overall like jaw structure and tooth structure, is it possible to maybe correct issue? Like, can you eat a meat-based diet and almost have it correct some of the things that like a traditional Western diet has screwed up? Is that possible? Like if my teeth are crooked and I switch to carnivore, can that help with my tooth structure? Or is it like you're already past the point of no return and you have to get braces? Have you done any research into that?
It can definitely help with not like preventing decay, periodontal disease, all these other oral pathologies. But when it comes to like craniofacial development, man, unfortunately the groundwork is laid during the developmental periods. And there are certain things like John Mew is a very influential person like that we can do to help make things slightly better, like training tongue posture, for example. Like when you sleep, the tongue should be at like the roof of the palate and you should be breathing through your nose. And a lot of people, the tongue will lie flat, block the airway, fall back. So there's certain exercises and things like that we can do to kind of make the situation better. But yeah, unfortunately, a lot of the craniofacial, like if I could start like fixing this face, I'd do it. There are surgical procedures like maxillary mandibular advancement, which is like basically they break the maxilla and the mandible, bring them forward. So basically to the point where like, oh, if you had a fully developed face, that's where it would be. And that opens up the airway, and it's a very effective treatment for sleep apnea, but it's a radical surgery that most people probably don't want to go under.
Have you ever experimented with mouth tape when you sleep?
I have not. And I do tell people, I think it's, I always caution people not to mask the problem, pun intended. But like if you have sleep apnea and you just tape your mouth, that's not curing the sleep apnea. And so for some people that just need to work on training to breathe through the nose, I think it can be a fine like kind of like a training aid, but I would not rely on it to fix like sleep disordered breathing. So I just am cautious of people using it when there's an underlying problem that could actually just make it worse. So I caution that, but I do know some people that use mouth tape effectively to help them breathe through the nose. And that's great because we need to be breathing through our nose when we sleep.
Yeah. I've been taking some glycine tea before bed and then mouth taping, and it's just purely anecdotal, and I don't know if it's a placebo, but I swear I could sleep like 6 or 7 hours and I wake up feeling amazing. So, but just anecdotal.
A lot of people take like glycine kind of like a relaxing kind of supplement. I mean, you get a lot in collagen and gelatin, which is high in glycine, like animal foods. But yeah, people have said that helps their sleep. So it always makes me think, I'm like, are you just not eating enough meat?
Yeah, right. Because there's
I know you're eating enough meat,
right? So. Yeah. You said there's right. Isn't there a lot of glycine in red meat?
Yeah, glycine. There's a lot of glycine in red meat, and there's a ton of glycine in collagen and gelatin, that parts of the animal. So people that want to get extra glycine, I'm usually like, hey, there's certain cuts like pig's head got a ton of collagen or a ton of glycine. But yeah, it's collagen, gelatin, things like that loaded with glycine. You can also supplement like you're doing. I don't have any problem with people throwing a little bit of supplement in here or there.
Yeah. One of the things that we've noticed is that there have been a number of people that were carnivore a few years ago that have since been incorporating a lot of fruit and honey into their diet. Just curious, your thoughts on that. Does it have a place in your diet? It sounds like you're pretty much all meat based, but would just love your overall thoughts on incorporating some fruit.
Yeah. I mean, there's a lot of thoughts I have around this in various areas. One is I'm very hesitant. Like, I don't like if someone says like, you have to do X, Y, Z. Like I heard growing up, you have to eat your fruits and vegetables, and look, here I am not doing that. So I don't think you have to. Definitely don't think you have to. I think it can help some people for a number of reasons. One, it can help transition into a meat-based diet, leave in some things, Two, it can make it doable in people's lives. Sometimes being so strict is just not doable in someone's life. So it can add the necessary flexibility people need, want, and they can do just fine with it. Especially people that are like active and they're pretty metabolically healthy. They can tend to get away with more of these, I'll call them the better plant-based foods. The fruits and roots are what I actually tend to think are the better options for plant-based foods. And people that are metabolically healthy that seem to tolerate those okay in limited quantities, I think it's fine. I do worry about some people that use these. I just see this all the time, especially honey and fruit, where it's like the gateway drug, where they started doing really great on a meat-based diet, meat-only diet. And then they said, XYZ said, I need fruits and honey, or they said, I should experiment with these. And then they just totally fall off the wagon.
Yes.
And they're back onto like a carb-based diet. They're not feeling good. They put the 50 pounds back on. And so I've seen like both sides of the story. To me, this is really important, where people just need to like kind of understand themselves, their goals, and it can definitely be a part of someone's diet for sure, healthy. But I do think people need to be meat-based. Like I truly believe like humans, we are a single species, far more similar than we are different. And we should be eating a similar diet. And that is a meat-based diet. And I would think that's probably 70+% of the diet. Now in that 30%, if you have some fruits, you have some roots, you have, some other, I'll say, I think we thrive that way. But that's not saying everyone should do that. And I know a lot of people that they try and add a little bit of that leniency and it does not work. Some people are better able to tolerate plant-based foods than other people.
Does fruit have a spot in your diet? Like, how do you incorporate it at all at this point?
No, I don't. So I've tested like I said, I've done various tests. And like I said, the roots, the potatoes are what I did best with. Both white and sweet potato I tend to do fine with, as long as I just don't eat a lot and I cook them properly. When I test in fruits, if I have like a very small amount, I do fine. But it's like, if I ever even push the envelope a little bit, like I'm saying like 2 servings of fruit, or sometimes just like a big apple. Recently, I tried, not too recently, but like the last time I did it, there was like these cosmic apples, big juicy apples. They're really good apples. Stomach distress each time I tried it. Yeah. And so to me, it's not worth it. Like I'm like, it upsets my stomach. Other things I've tested in was like white rice, because I don't recommend people eat grains in general, but if there is a grain that someone's going to eat, I think white rice is the best option. But personally, when I've tested white rice, I do fine digestively, but mentally it puts me back into where I was previously, like brain fog. I'm tired. Go get me another cup of coffee to try and finish the work for the day. So that has a negative impact on my brain function. I'm pretty sure it's just like a blood sugar spike and crash. But I do encourage people to test if they want to test various things. Usually it's beneficial to get healthy first and then consider testing. But yeah, like I think it's necessary for many people to fit into today's culture, just to feel like they're just not total outsiders eating only meat.
You mentioned cavities before. I guess looking at macronutrients through the lens of cavities, which like sugar, carbs is what I've been told or heard that causes a lot of cavities. Would fat and protein ever, like a more animal-based diet, would you ever get cavities if you just ate fat and protein?
If you just ate animal fat and protein, I'll clarify that. If you just ate animal fat and animal protein, you'll never get cavities.
Crazy.
What happens is I'm very cautious with and I'm writing like this macronutrient series, which if you guys have heard, if it fits your macros, is like a bodybuilding thing.
Right.
But the thing is, macros are not created equal. And so this is what this whole series is about. And the biggest difference in macros, like there's a difference in animal protein versus plant proteins, amino acid compositions, anti-nutrients, et cetera, et cetera. But the biggest difference is in animal fats versus plant fats. And so I don't equate those, because I actually think if we do subsist on plant fats, specifically vegetable seed oils, and you are not getting the fat soluble vitamins that you will get in the animal fats. And the animal fat soluble vitamins play a crucial role in creating strong teeth, especially in the developmental period. So if you subsist on animal fats, animal protein during the developmental period, you'll have strong teeth. And if you stay on that diet, you'll never get decay. What causes decay, I like to think of it kind of like 3 things. We have like this internal protection mechanism inside the tooth. So you have a tooth, you have enamels, the outside layer, you have dentin, which is, if you think of it like an apple, the enamel is the skin, the dentin is like the meat, and then the core of the apple is something called the pulp, which is the blood supply and the nerve. Well, we have dentin fluid flow, which helps create internal protection, basically. If you think of it as like immune system of the tooth. So that's one protection mechanism of the tooth. The other one is like salivary gland and minerals from the saliva that protects the tooth as well. And so these are our two protection mechanisms. And then sugar is the main culprit for like what's going to attack those protection mechanisms. So if you have strong protection mechanisms and you have some sugar, you're not going to get a cavity, right? You're able to defend it. If you have weak teeth, weak protection mechanisms, and you eat a lot of sugar, you're going to get decay. And it's like typified by someone like doing meth. Like in dentistry, we have something called meth mouth, and meth mouth is like the worst teeth you've ever seen, like rotting out, like it's meth mouth. But people that do meth, it shuts down both protection mechanisms. So it shuts down basically the parotid gland and salivary production. It shuts down the internal dentin fluid flow, and people that do meth tend to drink a ton of sugar, like classically Mountain Dew, and that's like the perfect recipe just to destroy your teeth.
Yep. How about just chewing and digestion, Dr. Kevin? How important is that in this whole equation?
I think this is an interesting one, and I don't have the answer because I relate it also to cooking. So like, what's the difference between a cooked steak, a raw steak? Like you just swallow a piece of raw steak, you just swallow a piece of cooked steak, you thoroughly chew each one of those. Is there going to be a difference in, absorption, bioavailability? And when I think it comes to like steak, like beef, my gut tells me the difference is going to be pretty minor. We got super acidic stomach that's going to do a lot of this breakdown. And so I eat my steak extremely, extremely rare. Some people almost call it raw, but I do the sear, safeguard, and that's about it.
Same category.
Let's go.
Yeah.
All three of us love that. Yeah.
That's how I like it.
Yeah.
And I'm pretty sure I'm getting all the absorption I would if I was cooking it more thoroughly, probably maybe even a higher bioavailability. I could potentially argue that. Now, with some foods like eggs, there is benefit to cooking like egg whites because there is some potential anti-nutrients that can disrupt absorption of biotin and other things. So when it comes to chewing, I do recommend people like fully chew their food. I don't want anyone like choking or anything like that. But I do think the impact is, I honestly don't know what the big impact is. I don't know if anyone's done research in this area either.
Harry, you already know what I'm going to ask next question, right?
I think so.
Yeah. Have you, I was going to ask Dr. Kevin if you're familiar with like Augenis Vonderplanitz or any of his work, or how you think about him.
What's his name?
His name's Augenis Vonderplanitz, and he's like, he's credited with the raw primal diet. So basically all raw meats, talks about raw milk, creams, steak, liver, etc. And I think one of his big things was like, when you're cooking the meat, you're denaturing the protein. I just don't know a ton about the science, but I mean, we're similar to you where it's like, we're basically just like searing our steak and eating it incredibly rare. And I was just wondering if there's any nutritional benefit to that or not overcooking the meat.
I think it's one of those areas of debate. And like the thing is, when that hits your stomach, super acidic hydrochloric acid is denaturing that biological protein regardless. So to me, that's not the kind of the main worry or thing. But people tend to have that, in my experience, a lot of people have improved digestion with rarer meat. And so there's something there for sure. And I'm not entirely sure, but what I generally recommend people is like, eat the meat the way you like it, because if someone was just getting started with an animal-based diet and they're like, I have to eat the steak like Kevin cooks it, it's psychologically challenging for people to eat something that rare. So I'm like, eat it how you like it. And what I see is when people do that, they gradually start moving more and more and more rare till they just turn into a straight up caveman. They're like, look, I like it basically raw.
Yeah. It's almost tough when you have to start cooking for other people. Harry came over in San Diego. We had a couple people over, and I'm like, holy shit, I don't even remember really how to cook a steak medium or like how long I'm supposed to do that. Cause it's like just quick sear, like 2 minutes total. And then you just pull it off and it's perfect.
Yep. So I had a couple buddies over the last several years. We had like these steak nights or whatever, but they wanted like medium. I'm like, dude, I don't know how to land a medium steak. I overcook it each time because I'm afraid like if it looks like it's bleeding like mine, they're gonna be like, no, I'm not eating that. So I err on the side of cooking a little bit long, but yeah, I always overcook it. And I feel like it ruins the piece of meat. I feel
100%.
pretty bad about it.
I was reading this thing today. Have you guys heard of the term Pittsburgh Rare?
Yeah.
I had never heard of it. Dude, so apparently these like industrial workers would show up to work with like a uncooked piece of meat, and they would cook it on like an 1,000-degree piece of machinery that it wasn't even meant for cooking. They would just like throw it on there and then do like a few seconds each side, and it would cook, and it's basically rare in the middle, but that's how they would cook it.
Yeah, it's like it's the step below blue. It's like Pittsburgh. But yeah, that's basically how I cook it. Like I do get the pan hot, sear like seconds, not like minutes, and then sear, and then it's ready to go.
We're just too impatient
and it's fast, it's good. Like there's everything, it's got everything going for it. It's safe, like you're safeguarding with the sear.
Kevin, I'm curious, what does good dental hygiene, or like what does your program look like for dental hygiene, just as like some actionable tips for people?
Yeah, it 100% depends on the diet. So a standard American diet, they need to really be brushing every morning. They need to brush at night. They probably should use like a fluoride toothpaste or a hydroxyapatite toothpaste, something that's going to help remineralize the tooth that they've been destroying all day with the standard American diet. They should be flossing. So they should be doing like the standard care because they're doing the standard American diet. Like we kind of talked about earlier, someone that like was raised on meat and they only eat meat, like you don't even need to brush your teeth. Like you're not gonna get decay. You can like brush off the biofilm if you want, but even that's probably not necessary for like to keep your teeth healthy. What I do is I'm gonna lose my dental license soon when I keep talking about what I do for oral care, but
but you clearly have white teeth, so whatever you're doing works.
Is working.
So I have an electric toothbrush. I do recommend electric toothbrush that gets rid of a lot of user error. So I use an electric toothbrush. Oral-B I like, and in the morning I just use water and Oral-B quick brush and done with that. In the evening I use a comically small amount of toothpaste, which is basically just to brush off any stains, because I am currently drinking coffee. I take that in and out of the diet, but I'm currently drinking it. So I'll use some toothpaste in the evening if I got a little stains. This is just vanity reasons for using the toothpaste, not so much of trying to remineralize the teeth, because if I'm not eating any carbs, there's probably not much that needs to be remineralized. So yeah, that's what I do. I do floss at night because of habit, and maybe a piece of meat got stuck in the teeth during the day or something like that. So I do floss, but that's my standard protocol.
Are you particular about the type of toothpaste that you're using?
It drives people crazy, but I'm not, because I use such a small amount that what I don't like about fluoride is that we're drinking it day in and day out, day after day, week after week, month after month, year after year, decade after decade, which I think can have long-term consequences. So I don't like drinking water all the time, but a tiny amount of fluoride in my toothpaste at night that I'm going to spit out, I'm not worried about that. A lot of people will worry about that. I'm like, I don't think I'd put your worry somewhere else. So no, I actually just use commercial. Crest Pro Health is what I tend to like. And so it'll have usually some fluoride in it, because you almost can't get toothpaste without fluoride. There's special brands you can get without fluoride, but I'm not really concerned about it. It'll have some kind of peroxide in it to help with like the stain removal. But yeah, I'm not really particular. If it has like a little minty flavor, maybe that's beneficial. My girlfriend's over or something.
Yeah. Do you have any recommendations for caffeine and coffee abusers like myself that struggle to mix it in and out of the diet? Because I feel like that's probably the only vice that I still have, is I'm probably like 3 to 4 cups a day, and I just really struggle to pull it out.
Yeah. So I say like 50 years from now, if we look back and be like, what's the worst part of my diet? I'd be like, it was the coffee. That's what I worry, because when we eat something, like if I went and had some ice cream right now and it's a one-time thing, one-time assault on the body, whatever, it's fine. Coffee is one of those things, day in and day out. Like, so if it is having a little bit of a negative effect, we may not notice it for like 3 decades down the road, but maybe that was the problem. So I don't think coffee is a health food. So I like to start with that. I do think so. I see it the same way as you do. I see it as one of my vices. I like it as like just habitual kind of thing to have next to me that I can sip on while I work. But if you did want to quit, which I do like to bring it in and out to see if it makes a difference. And I do recommend other people do the same, because I can't tell you how many people I've talked to that they did all this stuff right, and then they removed the coffee and that made all the difference.
Wow.
Like lifetime of migraines disappear. And especially people that suffer from headaches. I'm like, are you drinking coffee? Why don't you try with it, getting rid of that for several months and let me know how you go. Like, so it can make a big difference for people. But when I cut it out, what I do is I do a several step process. I don't rip the Band-Aid off. I slowly pull the Band-Aid off. So I start with decreasing the amount of grounds that I would use. And then sometimes I've done in the past, I would add a little bit of decaf to the grounds before it's like just, I'm actually just drinking decaf. So there's no caffeine withdrawal then at that point. And then it just, I stop drinking it. And usually I recommend, like, what I would do is replace it with something else like bone broth, because just the body habitually doesn't like to give up things. It would rather replace things. So replacing it with something else that you would rather drink instead.
That's awesome. Yeah, I feel like there's been a ton of actionable points that you've brought up that people will have a ton of takeaways from. One of the things that I was curious about asking you, in one of the videos that you posted online, you talked about like fossil records of teeth, and how that has been something that's you've pointed to where that indicates what we should and shouldn't eat.
Yeah,
I'm curious to just get your take on that, just as a cool little story, because I do think it's something that people probably aren't paying too much attention to.
Yeah. I am not a paleoanthropologist, but I have like taken a keen interest in paleoanthropology, because I do think I like to look at like the human genus on a timeline, and like there's general consensus among a lot of archaeologists where it's like, all right, humans have been around for roughly 3 million years. Okay, we can argue exact amounts of time, but like Homo habilis was roughly 3 million years ago. And we'll see like down the line, Homo erectus was about 2 million years ago. And Homo erectus was very much kind of like the bridge to what I would call like more of a modern human, like upright, big brain, hunter for sure, decimated the elephants basically. And Homo erectus was a very successful human species all the way to like 300,000 years ago, which was basically when Homo sapiens came up. So I find a lot of value in looking at like what hominids would have eaten, like what did they have access to, and then what was actually possible. Like if you're in Africa and you're a Homo erectus and you don't have a big colon like an ape because you've lost that, you now do not have the ability to survive on a raw plant-based diet in the wild. You are an obligate meat eater. You have to eat meat. And then there's like the expensive tissue hypothesis, which is pretty much like that's what it is. It's like in order to fuel this big brain, we have to be eating meat. There's no other possible way we could have evolved to be human without eating meat. And arguably it is meat that is what enabled us to become humans with these big brains and relatively small guts compared to like our hominid ancestors, like the apes. So specifically like a lot of this anatomy, prehistoric anatomy, I find fascinating. And then we look at the teeth, because teeth are basically the best fossils. They're 97-98% mineral. So we have all these bones and fossils, like, but for all those, we have a heck of a lot more teeth. And so we can infer from the teeth what our ancestors ate. And there's some good books on this that I've read from paleoanthropologists. And there's a lot of nuance in this, like everything in nutrition. So it's not like our teeth definitely tell us that we were meat eaters, because there's evidence of various things, various ways. But there's two things in particular that I like to look at. And one is isotopes. So if we look at stable isotopes, we'll see like the stable isotope nitrogen-15. We are able to figure that what that is in a teeth, and that helps determine like where an animal is on the food chain basically. And the amount of nitrogen-15 we have in our hominid teeth was like up there with wolves, like straight up apex predators, top of the food chain. We were eating the animals. Wow. So to me, that's pretty strong evidence. But there's also like other interesting evidence. There's a study that, the dental calculus tartar. So we can scrape off, you go to the hygienist, they scrape off the tartar or whatever. So that's pretty well preserved on fossils. And so scientists can sequence that to see what the oral biota was at that time. And so when they sequence a bunch of this dental calculus over the ages, they see they see two really dramatic changes. One of the big changes is about 10,000 years ago, start of the Neolithic and the agricultural revolution, our oral biota, like our oral microbiome, had a dramatic shift where we had a sharp rise in Streptococcus mutans, which is a strand of bacteria that is responsible for one of the strands of bacteria responsible for cavities. And so we actually see an increase of cavities at that time, unsurprisingly, as we started, becoming more agriculturist and less hunters. And then the next really big change we see in the oral biota is in the Industrial Revolution. And that's where these karyogenic bacteria strands became dominant. They're like the dominant strands in our mouth. And that's why everyone has decay these days, because we have the bacteria that are ready there to eat the carbohydrates and the sugar, to ferment them, to create the acid in the mouth, to create the decay. And especially since we don't have adequate nutrition, we don't have strong defenses against this acid environment that is produced by the diet, and thus the bacteria that we have now in our mouths. So, I mean, that's what, to me explains the dental decay today. And so there's like historical precedent for it.
Isn't there something specific about the quantity of HCl that humans have in their stomach too, specifically to break down animal protein?
Oh yeah. So we have, we're right up there with like the most acidic stomachs in the animal kingdom, like similar to carrion feeders who just eat, like they're scavengers who just eat the remains of dead animals. And the reason they have such high acidic stomachs is because it acts as like a pathogen filter. So if we go eat like a rotten piece of meat, it drops into the stomach, and the stomach basically is able to sterilize, kill those bacteria off so you don't get sick. So to me, that's and herbivores have like nowhere near that. And so if we kind of look at where humans are in like the stomach acid scale, we are carnivore, like undoubtedly on that end.
Oh, this is getting me ready to eat a steak. I don't know about you guys.
Yeah. Dr. Kevin, are there, is it pretty much all ground beef that you're eating right now? Are there any other types of meat like lamb or bison? Do you like to incorporate that stuff as well?
Well, like I said, I just picked up the next side of cow this afternoon, so I'll just be eating all the beef cuts. I do eat some other meats. I'll occasionally eat chicken, and I'll occasionally eat some pork. I'll eat some seafood, some shrimp, some salmon here and there. This is very much a minor part of my diet. I'll have eggs occasionally. I haven't eaten eggs this entire year, but occasionally eggs. These are all I almost feel like these are just like sides to my main my main meal. But yeah, unfortunately, we've changed cows' diets slightly. You can get grass-fed, grass-finished cows, but a lot of cows these days are finished on grains in order to fatten them up, make the most amount of money for the ranchers. But cows have complex stomachs, and this is probably something not new to anyone, but they're able to basically turn that small amount of poor feed, which might be like 8% of their diet or something like that, and they're able to turn it into high-quality fat. Well, monogastrics like pigs and chicken, they eat poor quality feed, and that poor quality feed ends up in their fat. So they have what I would consider poor quality fat. So if I'm eating chicken, I tend to just want to eat lean chicken. And if I'm eating pork, I tend to just eat lean pork. And that is unfortunate because bacon, everyone's favorite, is not the best source of fat. And I don't like to say that because, people are moving towards meat. I'm all for them. Like, look, if you need a vice, let it be bacon and not something else. But if we're just trying to optimize everything, I kind of feel like ruminants are the kind of the optimal food for us today.
Yeah, it seems like it takes a lot more energy to source chicken and pork correctly to actually fit it into the diet appropriately if you were trying to avoid exactly what you're saying, like the unhealthy fat nature of pork and chicken.
Yeah, and a lot of people I know a lot of people switch diets and want to make a diet change. Primary reason is they want to lose some fat.
Yep. And
I do believe a lot of the cause of obesity has to do with polyunsaturated fats. And this is a massive rabbit hole that, I'm happy to go down, but I think that people that want to lose fat, they come to the carnivore diet, and if they just start eating only chicken and pork, for example, and they still have a high polyunsaturated fat content in their diet, they may not see the results that they want. I just want to help people get the results that they want. And so one, by getting rid of the carbohydrates, you're already going to drop the insulin. So you'll probably see results. But if you really want to get results, I would say you drop the carbs down, but you also drop the polyunsaturated fats down.
Go ahead, Brad.
No, I was just going to say, I know you mentioned that you just purchased a quarter cow. Is a hyper local approach to eating really important to you? And do you try to advocate for some of your clients to make sure that they're buying from localized sources as opposed to getting their meat from the supermarket?
Uh, so it depends on, I always recommend people do the best you can, because certain things like grass-fed, grass-finished meat from a local farmer, not everyone has access to that. And then, so I don't like that to be like a deterrent. So do the best you can. I have 100% noticed a difference between grocery store meat and the cows. And I've bought in cows from farmers, both grain finished and grass finished, and both are different than the meat that I buy at the store. I don't know why, but it's undoubtable. So there is a difference in quality. And it's not like I'm just going to the cheapest grocery store down the street. Like I'm just like any normal fresh time is where I go. And the meat quality is not as good as what I get from the farmers. But I do think like there's an environmental aspect to this, which I think is deeply important. And cattle raised properly, and if you get it locally, like this goes a long way to fixing an environmental problem, a soil health problem. And so, of course, I encourage people, like if you have a local-ish farmer that you can buy from, it can be economical because you can do what I did. I just bought a half a cow. I split it with a friend. And so because you're buying in bulk, you usually save, like it might be $4 a pound or something like that. So usually it'll save there. Makes it easier. It's like I like it as a commitment device for people. Be like, all right, you just bought 200 pounds of meat. You are committed to eating that meat in the next year. So yeah, there's a lot of different aspects there, but I like, to me, it's like this: grass-fed, grass-finished, local farm. That's number one. Local, grass-fed, grain-finished. That's number two. Number three would be like ordering from a meat delivery service. They gotta ship that a long way. That's not like good for the environment, but like you're getting good meat still. So I don't think so. There's that takeaway, and then you can go to the grocery store. You can get grass-fed, grass-finished at the grocery store. You're going to pay an arm and a leg for that. But then, conventional beef, which I think is great as well at the grocery store. When you start getting to like more of the conventional chicken and pork, that's where there's a little bit more issues, because they are fed, I would consider pretty poor feed. And like we were talking about, that ends up in their fat, and it ends up in our fat.
Yeah, it's crazy. We've had some really good conversations with ranchers on the podcast, and one of them was Jason Rick, who talks about the Coors Act, which essentially a lot of the beef that we see at like even Whole Foods, like grass-fed, grass-finished, it's being shipped. And this speaks to your environmental point about like how far away has this cow traveled to get on my plate. It gets shipped as a whole animal to basically the Mexican border, and then gets processed or raised in like on its last like 60 days in the US. And then the labeling laws allow them to say that this is a cow that was from the US, when in actuality, that thing has traveled very far to get to your plate. So when you're talking about the environmental aspects, that's one of the things we try to talk about all the time, is like the soil health is a huge component of how this whole conversation comes together. And like, if you really want to be intentional about it, as you're saying, do your best and try to go local, because that's as good as you can get.
Yeah. I think when we are older, the conversation, climate change is a big conversation today, but I think the conversation, I don't know if it's a decade, 2 decades, 3 decades, but it'll be soil health, because
100%.
The soil is already degraded at astronomical rates.
Yeah.
And it will dawn on people that we can't technologically get our way out of this. We need to take care of our soils, or we're all gone. Like we're done if we ruin our soils. So that will be the topic of whenever that crisis comes. I think the crisis is like, we should already be thinking about that, but and ruminants are the way out, in my opinion. Like I've looked into this to be like, how do we fix this? And I don't see an answer besides, populating the earth with properly well managed ruminants. Beyond that, I'm like, that's the solution to fixing the soil and being able to feed the population.
Have you seen the documentary Beyond Impossible before?
I have not.
Yeah, you would love it. Harry and I talk about it all the time, because it's an amazing documentary, and it was directed by Vinnie Tortorich, who directed Fat Part 1 and Part 2. Great guy. And one of the most striking clips in the whole documentary is they have Pat Brown, who's the CEO of Impossible Foods. They have him on camera saying how if it was up to him and he had his choice, he would just eliminate all cows from the planet. And like, just to actually hear him come out and say that, it's like, dude, you're the scientist. You clearly seem like you're an intelligent guy, but just such a lack of understanding of ruminants and the role that they play in the ecosystem, the environment. It's just insane. So
Yeah, it's that's Shirky's principle in action, which is like institutions must preserve the problem, which they are the solution, because otherwise they go out of business.
Right.
Which is a shame. Like that's very prevalent in everything. But yeah, that's crazy thoughts.
One of the other things you touched on before is how you're pretty much all consuming ground beef, and we just talked through ruminant nutrition, but then also raw dairy as well. And just curious, what convinced you to start to incorporate, raw unpasteurized dairy into your daily routine?
Mostly questions that I've gotten from people be like, should I incorporate dairy, XYZ? And dairy, there's a lot of things to consider with dairy. It's not just like, are you lactose intolerant or not? There's the lactose intolerance. And so some people have a greater degree of lactase persistence, the enzyme to digest lactose. Then there's the milk protein, specifically casein. There's different kinds of casein, A1, A2. And so some people can feel sick as can be with milk that has A1 casein. They do A2 casein and they do fine. So you got to consider the milk sugar, there's the lactose, the milk proteins, specifically casein. Most people digest whey just fine. And then you have the raw component. So there's some people that when they can only do raw, but they do raw because it still has the microbes that help produce lactase to digest the lactose. And so they do fine with raw dairy. But raw dairy is, like without the reason pasteurization came around, because like if you don't source your raw dairy correctly, it can make you sick. And so you got to get the right source and stuff like that. So a long answer, but the short of it is I was just very curious to see how I would do with dairy. I'd never been a big dairy consumer, not when I was a kid, not as an adult. I would have little bits here and there, but I never thought I was lactose intolerant, because if I ever had some milk product, I never really had any big issues. So I really wanted to experiment with raw milk. And so I'm doing raw milk and I'm doing just totally fine. I started out the first week, I did a half gallon. The next week I did a gallon. This week I'm doing a gallon and a half. Next week I'll probably do 2 gallons that week. And I might just go until something breaks. I don't know. I'm curious what that point is. And then what I don't want to experiment, but I probably will do like not raw dairy and see if do I feel good or bad?
Yeah.
Then I might, because the dairy I have right now is A2 raw, grass-fed, it's the legit deal from a local farmer. But I'm going to maybe try the other ones to be like, hey, I did good with that kind, but this kind, not so much. So, it's just a kind of an experiment to see how I do. It might be something like that I can keep in here and there in the diet. I think it probably has useful benefits if I want to go through like a muscle building bulking phase or like a cutting phase to help preserve muscle. I think those are two kind of use cases from a bodybuilding perspective.
Yeah, I found it as a great like post-workout recovery. My recovery time seems to be much faster when I'm incorporating some raw dairy post-workout. But I think to your point, I think the like profile, the nutrient profile of that raw dairy is just so good in general. Are there any resources like books, podcasts that you would recommend people to go check out if you were, trying to get them a little bit more interested in all the things that you're talking about?
Yeah. I mean, I usually send people that are curious. The first thing I wrote, which was like back in 2017, which was why I started removing plants, and the ebook title's kind of clickbaity, Health Dangers of a Plant-Based Diet. But it goes through like various plant toxins that are in all these plant-based foods that we just assume are health foods. So I wrote that. It's like an 80-page ebook. And people start there and they get intrigued. And they're like, okay, well, how do I start this meat-based diet? So then I wrote a 30-day guide. Like, all right, this is how to get into it. And then the last ebook, which I'm working on finishing right now, is all the subsequent questions I get, which is, what about fiber? What about bringing carbs back in? What about fats? How much protein should I eat? Isn't that bad for your bones? Isn't that going to give me gout? Like the questions go on and on and on. Yep. And so I'm writing the quote unquote macronutrient manual. I've already written the carbohydrate part and the protein part. I'm writing the fat part now, which I think is arguably the most important part. So I'm taking my time. Each one of these parts has taken me like 9 months to write. So that's what I'm working on now. That ebook's not ready yet, but that will be soon. And then I think that's going to be the meat health trilogy. I'm looking forward to wrapping that up and having the meat health trilogy. But that's general resources where I, send people if they want to check that, like getting started, why do it? Okay, what about these other questions I have? What about vitamin C? All the standard questions.
Right.
Awesome. Is meat.health the best way for people to contact you just to learn more about your work and everything you're publishing right now?
Yeah, meat.health it's a site that I started in 2017 where I started writing about the plants and then the guide in 2020, I think 2021. So I'm losing track of the dates. I created Meat Health Academy. Yeah, it's all blended
2020
together.
to 2022. Just
yeah. So for people that really want to go super deep, I created Meat Health Academy, which is 20 hours of videos where literally it's like I go through the whole thing. Like, this is how to start doing it, the meat-based diet. This is how to tailor it. This is all the questions about why. This is the cholesterol, saturated fat. Like, that's the full thing. Like, if someone wants to go super deep, that's the place I send people. Like, all right, they want to know all the stuff.
Awesome. Well, this is doing great. I have loved your perspective on all these topics, especially as a dentist. Being able to bring that into the fold here has been really insightful. We touched on a bunch of things I didn't really know much about. So really appreciate you sharing that knowledge with us.
I appreciate you guys having me on. I hope I, provided value to your audience.
No, they're gonna love it. We're gonna have to meet up in person for some rare steak too, or some
absolutely.
Raw steak,
where
right?
are you guys at? Are you in Texas?
I'm in Austin.
Yeah, I'm in San Diego, so we're kind of dividing and conquering.
San Diego and Austin. I'll be in Austin next month for KetoCon.
Oh, sweet. I think we both might be there, so we'll have to link up.
Check out the fitness panel and the carnivore panel. All right, so I'll be on that.
Both of those.
Okay, awesome. Well, sweet. We're excited to link up, and thanks again for doing this, Kevin. Really appreciate it.
Hey, I appreciate you guys having me on.
Thanks.
And I look forward to staying connected on Twitter. I know you guys have some great Twitter feeds going.
Appreciate it.